seen these cases, I have a bag full of cases from my clinic as well. Now, this is going to be a little different because I want to cover a lot of ground, because more we see cases, we get the hang of how this method works in acute cases. So I am not sharing detailed follow-ups. You have to trust me on it that the patients did get better. What I want you to learn is the technique, that single snapshot of the presentation and how we jump to the rubrics, so that we are able to build that momentum and accelerate learning. So the first case is that of a multiple sclerosis. Now this lady, in the evening, she called me. She said that she had a weakness of legs and she was unable to walk. Because she said, there was a puja in the house and she prepared, there was a lot of exertion, and after which she felt that I felt very weak in my legs and this numbness has started. So then I asked her, what are you feeling about your condition? Now look at the questions, right? I asked her what. In what is always, the patient will generally talk about their concerns. What is it about the problem is bothering them? So it makes it a little open-ended question. So this patient answered, nothing. I just want to get well. I don't know why it happened suddenly. There was a lot of restlessness in her voice. I don't know what to answer. I have told doctor, I have told you all my symptoms. What more do you want to ask? So she was not very, open to questioning and answering my questions. That was it. And she wanted, the medicine. Then I asked her, what is so horrible about being in such a condition? Then she answered, what do you mean? I don't want to be paralyzed. That is my biggest fear. Then I shall never be able to get better. Doctor, I have told you all my symptoms. I have nothing more to add. Please give me medicine fast so that I can walk. Should I send my husband now? He can reach in 15 minutes. That was the conversation, and that's about it. Now, how are you going to pick the rubrics? The rubrics that I took was the way she talked to me. See, the manner in which the symptoms are conveyed is very important. So you are looking at certain parts, the manner or the kind of expression, how of the narration, and then why is she's getting so worked up? Wow, what is it about it, right? And what does she want from you? So all these things, if we are able to have that mental note and fill in the blanks in our head, we can come to the rubrics quickly. So this is answers curtly and abruptly. There is fear of paralysis, which she said that I don't want to be paralyzed. She wants to be carried, desires to be fast. When can I send my husband was her question, right? Despair of recovery. I might never get well. That was her say, right? So based on these symptoms, I gave Aconite 200, right? And also, when we do that, also since we are aware of our remedies, we know our remedies well, so we have this thing, there's this background thing running in our head, the genius of Aconite. So this restlessness, impatience, and there's always also numbness, some kind of physical this thing to also go with it. So that gives your prescription a very solid standing. And she was well.
Okay, so now we are going to talk about a case of panic disorder, but not of a human, of a dog.
Okay, so it was Indian female stray dog, and so it was our patient who's been taken this stray dog. She was found in the road accident, and then she's been taking care of it. Then she had a big cut on her ribs, which was then treated, and after a month she was adopted by the patient's family. Then she approached her basically for the intense fears and the bacterial infections that she had on the body. Also, she mentioned about the motion sickness and sleeps most of the times in the car.
So the fear and also
Fine.
the motion sickness, because of which she would sleep in the car.
And then we asked about her as a nature. She says she's very sensitive and a meek dog. Very little confidence in her earlier, which she developed on gradually. She needs a lot of positive reinforcement. She craves attention. Initially, she had a lot of separation anxiety and would want all three of us around her. like the patient, her husband, and the son. She used not to be a very friendly dog. She was passive aggressive and would bore and grind her teeth in anger. She didn't used to like other dogs or puppies, so she was not mixing. She was afraid of the sounds of cars and vehicles. Lot of fear of thunderstorms and rain.
Especially when the lightning, when the actual thundering happens, she would be like literally very, very, very scared, no?
Yeah. So she would run and try to hide somewhere in the corner, or maybe go to the bathroom and sits there, and that is like the very comfortable place for her. She even feared the firecrackers during Diwali. So it's very difficult for the patient's family to move out of town also during Diwali because of this noise. Then fear of these doctors when she takes her for the vaccination or any other things. Fear of going in elevators. Then she also fears the other dogs. So lot of fears, and her reaction was like a panic. And what happens in the fear, that she trembles whenever she hears these noises. She'll run here and there and try to hide in her favorite spot, and then vomit there and keep hiding. She also loses the control over the bladder during fear and trembling. Weak bladder. Also, she had given anti-anxiety medications during the Diwali and those festivals where there are a lot of noises happens in India, a lot of drums and loud noises. And due to fear, she had bad odor, which used to come from her body. And then this was a past history where she had done hysterectomy. There were some very specific desires for milk, cheese, paneer, um, curd, ghee, butter.
So everything milk and milk products.
Yeah. So we took all those rubrics of all those fears, for fears of thunderstorm, fear of riding when carriage in, from sudden noise. Okay, and she's frightened suddenly, easily, waking on from the slightest noise.
So firecrackers or vehicles, what is that? That basically symbolizes a very sudden noise, which comes like a slightest noise, and this person is basically getting very, very fearful.
Also about the involuntary urination, very timid, she mentioned, so introverted, and those um, the cravings that we took of milk and milk products, and then hysterectomy that she had done. So the abdomen uterine complaints and the other bacterial infections which she used to get, and she had a typical kind of those ones which are red, around, like completely red, and then in between there is a white spot, very very prominent kind of infection that she used to get. And we could see that the borax, which is a very very important and a good remedy for these fears and these sudden panic and sudden noise, elevators and all those, and that has really 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 helped her. The skin infections, they are still going, she is on the treatment, but the fear, immediately she could see the difference.
ಓಡಿದಾಗ ಜತ್ತಿದ ಮಗ ಹೆಂಗ ಒಂಜಿ ಕಡೆ ನಾನೊಂಜಿ ಕಡೆ ಬಚ್ಚಿ ಕೇರಿಂಗ್ ಅಂಡ್ ಹೆಂಕಂತ.
So the follow-up was, she's doing fine, the lesions are good, they're almost cleared up. She wants to meet the other dogs and mingle with them. Her passive aggressiveness has quite a lot reduced. The firecrackers were there this time, but she was not frightened. She kept sleeping in her place. She did not rush or hide to her favorite spot, that is a bathroom. So this was one new follow-up. And I think we can hear from her.
Hi, I want to share my experience with homeopathy treatment for my canine daughter Maggie. Maggie is an indie and she's had a lot of trauma issues in the past. She had these recurrent skin infections which weren't going despite a lot of treatment. So that's when we decided to switch her to homeopathy. And within a couple of weeks of homeopathy, she began to look cheerful. Her nature, her behavior changed. She became relaxed, more playful. The skin infections are also going slowly, but the biggest victory for us has been that Maggie is a lot less frightened of loud noises, and overall she's a happier doggy. She's enjoying life much more thanks to the treatment from Healing Harmony.
Yeah. So think of borax in case of panic, extreme fear. We know boron, right? We know the column 3 features of boron. So borax is a very, very important remedy. You should keep it, especially in acute panic.
And young fellow, 26, he came with a lot of style and mannerism, okay? And he sat with his legs crossed, hand across the chair, and he had some accident, so there was a big injury lump on the center of his forehead. He said, I want to remove this should be of the same level. Then others ask, I feel bad, clear it up fast. I don't go to village for more than 15 days because I have a respectable job here. So I don't go to village. This Tirupati bungalow is mine. We look after that place. My marriage is fixed in the village. Girl's family has not seen my face, but they will ask. And he was holding his hand like this. Make me all right fast, doctor. You're God for me. I have managed my graduation by making others give my exam. There were hard days, but I made big buildings in village. Want this to come to 11, I will thank you. First time I've come to you, otherwise I would have gone to big hospitals. So what is the feel this person is giving? He is come for injury on the forehead and he is looking like a middle class person. Tirupati bungalow, what he's talking about, fortunately, is a shut down boarding and lodging hotel, which is very close to my clinic. So I know that place. His uncle was the security guard, and since this fellow has come from the village, he said, "You do something. You look. You stay here so that I need not stay here all the time as a security guard. So you stay in one of this room. As it is, this hotel is shut and nobody is going to ask, or there's nobody's. The owner is also far off." See the way he said the whole thing. So what do you catch in this? He gives you the impression he is a great person, delusion, great person he is. He is in communication with God. God, doctor, you are no God. Delusion of wealth. The way he's talking as if he's a great man, as if, he's so wealthy. This Tirupati bungalow is mine. I have built big buildings in my village. Egotism, haughty, pompous, contemptuous. I would have gone to big hospital. I just came to you. Boaster, braggart, wishes to be considered as rich. And whenever he'll be coming to the consulting, he'll be talking so loudly on the phone that he'll not be bothered that there are patients or even I'm in the consulting. Noise inclination to make. My girl's family will look at my, ask, what is this? Despair of social position, fear social position about his, reverence. The Ratran has no reverence for those around him. Truth telling the plain. I have got passed from the exam by making somebody else give the exam. Truth telling the plain. You're just telling it. What are you doing? You're telling the truth, the naked truth. Liar lies, never speaks the truth. Does not know what she's saying. Tirupati bungalow is mine. Array, you're lying. Fortunately, I know. Praying. Carried desires to be carried far. See the how. You have to catch, you have to observe and you have to catch beyond words. So on repetrizing, Veratrum Hyos, Stramonium and Lyco came close remedies. Veratrum 200, 3 powders were given. So let's see a DD of Hyoscyamus. How would be the how of Hyoscyamus? Now, Hyoscyamus has a deep feeling within him that he has suffered wrong. So this feeling is so much ingrained in him that when he comes to your clinic, he'll be very inquisitive. He'll be very cautious. He'll be very curious. Are you sure you have cured this case? How many cases you have cured? Or he'll ask some neighbor or some friends. Everything he'll ask about you. Why? Because he feels he delusion place, he was in the wrong place. He doesn't want to be in the wrong place. He doesn't want to be wronged again because he fears of being betrayed. He feels he'll be sold again. So he's very suspicious. He has affectation. He will not show what he's feeling, the amount of suspicion he feels beyond all this. But he's a person who's more trustworthy and who will respect if you tell the truth to him, or even he will tell you the truth. He will not want to show that he's scared. So he has light shuns. He has light aversion to shuns. He does not want to know that I'm having sick or I'm having ulcer, or he would rather not do any investigation to know what is his problem. But he will try to fight it out. He'll be high spirited, and whenever hyosamus talks to you, he'll talk to you with respect, unlike Paratram. So reverence for those around